Hi, I'm Dr. Ruan Louw. I'm a cardiologist, but more specifically, I'm an electrophysiologist. We specialize in the treatment of heart rhythm disorders. So when we perform ablation procedures for the treatment of atrial fibrillation, our biggest challenge is to create durable lesions in the heart that affects the rhythm problem, but doing so in a safe and effective manner. So our main aim in the treatment of atrial fibrillation, specifically related to ablations, is to eliminate the rhythm problem, the atrial fibrillation, thereby increasing patients' quality of life, reducing the risk of heart failure, and also in reducing the risk of stroke. So we're really excited to be able to use this new technology called Pulsed Field. And essentially what this allows us to do is we are able to deliver more energy, more effectively, in a safer manner for our patients with atrial fibrillation. Now the exciting thing about Pulsed Field is that it is able to change the substrate of the rhythm problem by delivering an electrical field to the tissue in a completely safe manner that only affects the heart muscle without any collateral damage to tissue around the heart. And that allows us to reduce the risk of complications, deliver energy in a more effective manner, thereby increasing the chance of success to eliminate the patient's rhythm problem. What makes this specific technology so exciting is the fact that we are able to deliver pulse field energy using a balloon in basket delivery method. And this balloon shields the blood from the electrodes through which we deliver the pulse field, thereby allowing all the energy that's being emitted by this balloon in basket to enter the tissue, but without the energy affecting the surrounding blood. And why is this important? When we deliver the energy into tissue, we create safe and effective lesions that eliminates the rhythm problem. However, when we deliver this pulse field energy into blood, we create a risk of complications. And previous technology had the problem that a lot of the pulse field was delivered into the blood. And this resulted in breakdown of red blood cells, toxins, which are then possibly dangerous to the kidneys, causing even kidney failure and increasing the risk of blood clot formation during the procedure. So we're really excited and privileged to be able to offer the first patient in Africa and Middle East this very special pulse field balloon in basket technology. We're going to start with our first procedure. Let's go.